Listen, I need to tell you something that your doctor might not have explained clearly enough when they handed you that prescription. Right now, millions of people over 60 are taking blood pressure medications that could be silently damaging their kidneys, and most of them have absolutely no idea it's happening. I'm Dr. Tasuku Honjo, and in the next few minutes, I'm going to share information that could literally save your kidney function and potentially add years to your life. Now, before you panic and throw away your medications, stay with me, because what I'm about to share isn't about stopping your treatment. It's about understanding what's happening in your body and having the right conversation with your doctor. So if you or someone you love is over 60 and taking blood pressure medication, this might be the most important video you watch this year. You know, I've been practicing medicine for decades, and one of the most frustrating things I see is how we sometimes solve one problem while creating another. Blood pressure medication is absolutely essential for millions of people. It prevents heart attacks, strokes, and saves countless lives every single day. But here's what bothers me. When you hit 60, your kidneys aren't what they used to be. They've been filtering your blood nonstop for 6 decades. They're like a car with 60 years of mileage on it. They still work, but they need more careful maintenance. And certain blood pressure medications, while they're protecting your heart, might be putting extra stress on those aging kidneys in ways that don't show up on standard tests until significant damage has already occurred. The challenge is that kidney damage is sneaky. It doesn't hurt. You don't feel it happening. Your kidneys can lose up to 75% of their function before you experience any symptoms at all. Think about that for a second. 3/4 of your kidney function could be gone, and you'd feel completely normal. You'd wake up, go about your day, feel fine, while inside, your kidneys are struggling. This is why I call certain medications silent destroyers, because the damage accumulates quietly, month after month, year after year, without ringing any alarm bells until you're in serious trouble. Now, I want to be crystal clear about something before we go any further. I am not telling you to stop taking your blood pressure medication. Please hear me on this. Uncontrolled high blood pressure is dangerous. It's a killer. It damages your kidneys, your heart, your brain, your eyes, everything. What I am telling you is that you need to be informed. You need to understand which medications carry higher risks for your kidneys after 60, what warning signs to watch for, and what questions to ask your doctor. This is about being an empowered patient, not a reckless one. Let's talk about the first medication class that concerns me most for people over 60, and that's NSAIDs, or non-steroidal anti-inflammatory drugs, used alongside blood pressure medications. Now, I know what you're thinking. Wait, those aren't blood pressure medications, you're absolutely right. But here's the thing. So many people over 60 are taking blood pressure medication and regularly using NSAIDs like ibuprofen or naproxen for arthritis, back pain, headaches, or general aches and pains. When you combine these with certain blood pressure medications, especially ACE inhibitors or diuretics, you create what we call a triple whammy effect on your kidneys. Here's how this works. Your kidneys rely on a delicate balance of blood flow to function properly. ACE inhibitors reduce pressure in the vessels leading out of the kidney, which is normally fine. Diuretics reduce blood volume, again, manageable on their own. But NSAIDs reduce blood flow into the kidneys by constricting the vessels. When you put all three together, you're squeezing your kidneys from multiple directions. It's like trying to water your garden while someone's stepping on the hose from 3 different angles. The blood flow to your kidneys drops dramatically, and cells start to die from lack of oxygen and nutrients. Studies show that older adults taking this combination have a significantly higher risk of acute kidney injury, and even more concerning, repeated episodes of acute kidney injury lead to chronic kidney disease. Your kidneys get damaged, they try to heal, they get damaged again, and each time they heal a little less completely than before. Over months and years, this adds up to permanent kidney damage that cannot be reversed. I've seen patients with perfect blood pressure control who end up needing dialysis because nobody told them that taking ibuprofen regularly with their blood pressure medication was dangerous. It breaks my heart because it's preventable. The second medication class I need to talk about is diuretics, specifically the type we call loop diuretics, with furosemide being the most common one. Now, diuretics are often called water pills, and they're incredibly effective at lowering blood pressure and reducing fluid retention. But in people over 60, especially those who are on higher doses or have been taking them for many years, these medications can cause significant kidney problems through a mechanism most people don't understand. Loop diuretics work by making your kidneys dump sodium and water into your urine. They're powerful, they work fast. But here's the problem. When you lose a lot of fluid, especially if you're not drinking enough water to compensate, your blood volume drops. Your kidneys need adequate blood flow to function, and when blood volume is low, kidney function suffers. This is especially true in older adults who often have a diminished sense of thirst. You might not feel thirsty even when your body desperately needs water, so you're taking a medication that's pulling fluid out of your body while your natural thirst mechanism isn't telling you to drink more. The result is chronic low-grade dehydration that steadily damages your kidneys. But there's another issue with loop diuretics that's even more insidious. They cause you to lose potassium, magnesium, and calcium along with the sodium and water. These electrolyte imbalances can directly damage kidney cells. Chronic low potassium, which is incredibly common in people taking loop diuretics long-term, can cause the tubes in your kidneys to develop cysts and scarring. I've reviewed kidney biopsies from patients on long-term diuretic therapy, and you can literally see the damage. The kidney tissue shows chronic changes that look like accelerated aging. It's as if the medication added 10 or 15 years of wear and tear to kidneys that were already 60 years old. The third medication class that worries me, particularly in the over 60 population, is a combination that includes angiotensin-converting enzyme inhibitors, or AC inhibitors, along with angiotensin receptor blockers, or ARBs, when used together. Now, individually, these medications are actually kidney protective in many situations. They're often prescribed specifically to protect kidneys in people with diabetes or early kidney disease. But when doctors combine them, which was trendy about 10 or 15 years ago, because we thought more blockade of the renin-angiotensin system would be better, we actually found the opposite was true, especially in older adults. The problem is that both ACE inhibitors and ARBs work on the same biological pathway that helps maintain pressure in your kidney's filtering system. A little reduction in that pressure is good. It protects the delicate filtering membranes. But too much reduction, which happens when you use both medications together, can cause your kidney function to drop precipitously. Your kidneys need some pressure to push blood through the filters. When you reduce that pressure too much, the filtering rate drops, waste products build up in your blood, and your kidney function tests start to look terrible. What makes this especially dangerous after 60 is that older kidneys are already less efficient. They have less reserve capacity. If your kidney function drops by 20 or 30% when you're young and healthy, your kidneys can compensate and you might not even notice. But if your kidney function drops by that same amount when you're 65 or 70, you might not have enough reserve to compensate. You can tip from having mild kidney disease to moderate or even severe kidney disease relatively quickly. I've seen patients whose kidney function was stable for years suddenly decline rapidly after a doctor added a second medication blocking the same pathway. The fourth medication situation I need to address, and this one is really important, involves blood pressure medications in people who also have contrast dye studies done. Now, this isn't a medication class per se, but it's a combination scenario that destroys kidneys in older adults more than almost anything else I see. Here's what happens. You're over 60, you're taking blood pressure medication, particularly ACE inhibitors, ARBs, or diuretics, and you need a CT scan with contrast dye. Maybe your doctor is checking for a pulmonary embolism or investigating abdominal pain or doing a cardiac catheterization. These procedures use iodinated contrast dye that shows up beautifully on imaging but is toxic to kidney cells, especially in older adults. The contrast dye itself reduces blood flow to the kidneys and causes direct toxicity to the cells in the kidney tubules. When you're also taking medications that are affecting kidney blood flow or blood volume, the risk of contrast-induced kidney injury skyrockets. What should happen is that your doctor should stop certain blood pressure medications a day or two before the contrast study, make sure you're well hydrated, and then restart the medications carefully afterward while monitoring your kidney function. But in the real world, especially in emergency situations, this doesn't always happen. Someone comes to the emergency room with chest pain, they get rushed to the cath lab, they get contrast dye, and nobody thinks to ask about their blood pressure medications or stop them beforehand. I cannot tell you how many times I've seen someone come into the hospital with normal or near normal kidney function, have a contrast study while on their usual blood pressure medications, and then watch their kidney function crash over the next 48 to 72 hours. Sometimes the kidneys recover, sometimes they don't. And in older adults with already reduced kidney reserve, recovery is less likely. People end up on temporary or even permanent dialysis because of a preventable drug and contrast dye interaction that nobody warned them about. So what do you do with this information? How do you protect yourself? First, and most importantly, you need to know your kidney function numbers. Ask your doctor for something called a GFR, which stands for glomerular filtration rate. This number tells you how well your kidneys are filtering waste from your blood. Normal is above 90. Above 60 is generally okay. Below 60 means you have chronic kidney disease, and below 45 means your kidneys are significantly compromised. If you're over 60 and taking blood pressure medication, you should know this number, and you should have it checked at least once a year, maybe more often if it's trending downward. Second, you need to have an honest conversation with your doctor about your medication regimen. Ask specific questions. Doctor, are any of my blood pressure medications harder on kidneys in people my age? Could we achieve the same blood pressure control with medications that are gentler on kidney function? Is there any reason I'm on multiple medications that affect the same pathway? Am I on the lowest effective dose of my diuretics? These aren't confrontational questions. They're smart questions. Any good doctor will appreciate a patient who's engaged and thinking about their long-term health. Third, if you're taking blood pressure medication and you regularly use over-the-counter pain medication, you absolutely must discuss this with your doctor. I mean, really discuss it, not just mention it in passing. Tell your doctor exactly what you're taking, how often, and how much. Ask about alternatives. For many types of chronic pain, there are options besides NSAIDs. Acetaminophen is easier on kidneys for many people. Physical therapy, exercise, weight loss, topical treatments, these can all reduce pain without putting your kidneys at risk. If you absolutely must take NSAIDs, you need closer monitoring of your kidney function, and you might need adjustments to your blood pressure medications. Fourth, hydration becomes increasingly important as you age, especially if you're on diuretics. I know it seems counterintuitive. You're taking a water pill, so shouldn't you drink less water? No. The pill is making you lose sodium and water to lower your blood pressure and reduce swelling, but you still need adequate fluid intake to maintain healthy kidney function. For most people, this means drinking enough that your urine is pale yellow, not dark or concentrated. If you're not sure how much to drink, ask your doctor for specific guidance based on your individual situation. Some people with heart failure need to restrict fluids, so this isn't one-size-fits-all advice. Fifth, be extremely cautious about any procedure involving contrast dye. Before any CT scan, MRI with contrast, or cardiac catheterization, make sure the medical team knows all your medications. Ask specifically whether you should stop any blood pressure medications before the procedure. Ask about prehydration protocols. Some hospitals give intravenous fluids before and after contrast to protect the kidneys. If your kidney function is already reduced, ask whether the study can be done without contrast or whether a different type of imaging would work. Sometimes the answer is no. The contrast is absolutely necessary, but sometimes there are alternatives that nobody thinks to offer unless you ask. Let me share something that might surprise you. The goal isn't necessarily to avoid these medications entirely. For many people over 60, the benefits of blood pressure control far outweigh the kidney risks, even with the medications I've discussed today. The goal is informed decision-making and appropriate monitoring. It's using the right medication at the right dose for the right person with the right follow-up. It's understanding that what works perfectly for a 45-year-old with healthy kidneys might need adjustment for a 70-year-old whose kidney function is declining. Modern medicine has given us incredible tools to manage blood pressure and prevent cardiovascular disease. People are living longer, healthier lives because of these medications, but like any powerful tool, they need to be used skillfully and with awareness of potential downsides. Your kidneys at 60 are different from your kidneys at 40. They have less reserve, they're more vulnerable to injury, they recover more slowly from insults, and they're more sensitive to medications that affect blood flow and electrolyte balance. The good news is that with awareness and appropriate management, most people can control their blood pressure effectively while protecting their kidney function well into their 70s, 80s, and beyond. I've seen it thousands of times. Patients who are informed, who work collaboratively with their doctors, who get regular monitoring, and who make thoughtful choices about their medications tend to do remarkably well. It's the patients who just take whatever they're prescribed without understanding it, who don't get regular lab work, who self-medicate with over-the-counter drugs without mentioning it to their doctor. These are the folks who run into trouble. One more thing I want to mention before we wrap up. Kidney function naturally declines with age. On average, you lose about 1% of your kidney function per year after age 40. By the time you're 70, even if you've done everything right, your kidneys probably aren't functioning as well as they did when you were 30. That's normal aging. The question isn't whether your kidney function will decline, it's how fast. Medications can accelerate that decline, but so can uncontrolled high blood pressure, diabetes, obesity, smoking, and a sedentary lifestyle. The most kidney protective strategy isn't avoiding medications. It's controlling your blood pressure, managing your blood sugar if you're diabetic, maintaining a healthy weight, staying active, not smoking, and yes, using medications wisely with appropriate monitoring. Think of your kidneys like a car engine. Regular maintenance keeps it running smoothly for a long time. Ignoring warning signs and running it hard without care leads to breakdown. Your blood pressure medications are part of that maintenance system, but they need to be the right type, the right dose, and monitored to make sure they're helping, not hurting. You wouldn't just pour any random fluid into your car's engine and hope for the best. Don't take that approach with medications affecting organs as vital as your kidneys. I hope this information empowers you to take control of your kidney health. I hope it motivates you to have a conversation with your doctor that you might not have had otherwise. And I hope it helps you understand that being over 60 and on blood pressure medication doesn't mean your kidneys are doomed. It means you need to be informed, proactive, and engaged in your care. If this video helped you, do me a favor and share it with someone else who might benefit. Post it in your community groups, send it to family members, help spread this information because kidney disease is often preventable, but only if people know what to watch for. Thank you so much for watching. I'm Dr. Tasuku Honjo, and remember, your health is your wealth. Protect it wisely. I'll see you in the next video.